So I'm so excited to introduce you to Zach, to bring him on screen. But I want to thank you and explain to you about how the interview will work. Hey, Zach.
Hello. Hi, Ariella.
I was just telling the group here that you're coming on to join us. I'm going to share a bit how the interview will work, which is that I will start with the questions. I'm going to dominate at the beginning and ask
You're the boss.
Zach, please. I'm the boss. Sometimes I call it dictatorship style. I do what I want. And then I'm going to have questions from the participants. So you guys send in your questions. I'll be reading the chat. I'll pick out some good ones to ask Zach at the end of our initial discussion. And I saw some really good questions already from the first hour. So please bring some of those up again. All right, welcome, Zach. Let me stop sharing so people can see you on the big screen.
Thank you. Thank you for the invitation. It's a pleasure to be here with you this evening on this very fantastic topic.
Well, thank you so much. We could not be happier to have you as well. And I just want to dive straight in and ask you to please introduce yourself to everyone.
So, yes, sure. So my name is Zach, or Dr. Zaki Allal. I am a medical doctor by training. I've trained at the University of Oran in Algeria, and I've previously worked in Silicon Valley for Google in California. I had my own biotech startup and have other degrees from Harvard Medical School and Harvard School of Public Health. I currently work in Finland as a medical doctor, a neuroscientist, and work as well in medical technology and innovation.
Okay, a very impressive resume. So I have a few questions for you, and it's interesting because last week in our medical English class, the participants' level of English was a little bit lower. So we spend most of our time talking about linguistics. So I have a few linguistics questions, but the participants today are actually way more interested in mental health. So we might just try to answer these quickly. But can you tell us a little bit about when you first learned English, like medical English? What was that experience like? And how important is it for your field to have a mastery of that technical level of English?
Oh, I think medical English, that was a long time ago. I think it was when I was in medical school, maybe the second, third year, I was already thinking about passing my boards in the US. And I knew that it was going to take some time to prepare for the USMLE and the exams and looking at all the lectures. Beginning, it was a little bit challenging because of all the different terms and the different clinical terms, the different medical terms. But it wasn't of a big of a challenge because at the same time, when I was going through those exams in med school, I was taking those lectures from the USMLE preparation material, for example, and studying those same topics in English in parallel to med school, because we all know med school in Algeria is in French. So I think that was kind of how I started to learn English. And then, of course, I had the chance to go and do clinical rotations at Harvard and Oxford in the UK. So that was kind of like more of a practical learning and an opportunity to learn more of the terms and also learning at how things are said and done in practice in the hospital, for example, or in the wards. It wasn't only about, and I think this is very relevant also to our audience, is that sometimes, when you think in French, especially if you study in French and you try to translate or transpose that translation and the term in English, sometimes the way you say it in French isn't the appropriate way to say it in English. And that was something that I had to learn. How you communicate with a patient and how you transmit a certain message was very different. So, for example, it's just a couple of weeks ago, I was talking to a colleague from Paris, and we were talking about the word consciousness and how you define it. And based on if you're having your mindset, if it's an English mindset or your French mindset. Consciousness could mean awareness, could mean being awake, could mean morality, could mean doing something stupid, if you say it in French, or consciousness meaning the high level of being, of awareness. So it's very different. And I think the biggest challenge wasn't to learn the words, it was to switch from the French mindset to the English mindset.
Okay, amazing. Thank you for that. I am particularly happy to hear that answer, because I'm, as an English teacher, often explaining the translation is not always what you need. It's the communication.
Yeah.
Amazing. Thank you, Zach. Yeah. Now let's move over to the mental health field. What have your experiences been, both as a researcher and practically working in mental health?
Well, I've worked in mental health in Algeria, in France, in the US, in West Africa, in Finland, and all those areas have differences, obviously, because mental health is so subjective that it is influenced by religion, it is influenced by culture, it is influenced by language, by sociology, by economics, etc. So I think my focus is to make sure that wherever I am, first of all, my priority is to ease the pain and relieve the patient. And that is the main mission and goal. Whether I have to do it with chemistry, or whether I have to do it with non-chemical ways, whether you have to do it with just simple words, or what I call light interventions, and we'll talk about them later. It depends. The bottom line is to seek the patient relief from distress and pain. Mm-hmm. And I think it has been a very, very interesting experience, and we can discuss furthermore later.
I love that you've had this intercultural perspective. It's so unique. A doctor who's worked in different cultures, across different languages even. Can you speak more about working with mental health in Algeria, and perhaps do you see a trend? Are more people seeking treatment for mental health symptoms? Is there more perhaps positive engagement around mental health? Anything around mental health in Algeria would be interesting.
Absolutely. There is a trend. And in fact, because of Algeria's history and Algeria's context and environment, Algeria has gone through so many traumatic historical events that are still present to this day, but invisible. But at the same time, we experience them throughout the daily routine in Algeria. I think there is a very, very big need in Algeria when it comes to healing PTSD. I think my personal opinion from my work in the field in Algeria is that there is probably a very high prevalence, meaning there is a high number of PTSD in Algeria. This, of course, manifests through anxiety, through depression, through addictions, which are all, at the end of the day, are all symptoms of a much deeper underlying distress. Just the usual and the daily traffic, for example, in the capital, is something that is going to have an impact. And previously I heard you speaking about, and the audience's remarkable answers on the interaction between the body and the mind and the mental health. Of course, there is an interaction. If you go through every day through traffic jams every single day, that high level of stress and that high blood pressure is going to manifest through high blood pressure and through other manifestations. So yes, there is an impact. And the trend that I see in Algeria is this. There is another trend, I think, that is pretty alarming, that is about addictions, and especially illicit substance use. I think there is a big work to be done there. And it doesn't have to be work that is only clinical. It is also work that is about awareness and advocacy. And this is where our audience can play a big role in terms of transmitting the correct information and the right information about specific disorders. When it comes to advocacy, you have to learn, of course, document yourself pretty well so that you can be a resource and a support for somebody around you. This is kind of what I've seen as a trend in Algeria. I think, I've seen also a lot of stigma, to be honest with you. This is something that has to change, especially in the clinical practice as well. So to give an example, in French, I've seen some healthcare professionals unfortunately, labeling people who have a substance use disorder with the label addict or drogué. And this has to change, because if you notice in every single medical literature today, we talk about condition. We don't talk about something that is permanent. We talk about the condition because inherently it is transient, it is temporary, it is a situation in which a person is, and we have to help that person to get out of that bad situation. So when somebody has a substance use condition, you are there as a support to take them out of that condition. And stigma today, we have to be very careful about the labels we use when and the words we use when we talk about people who have mental health issues.
Thank you, Zach. Those are some very interesting trends. And I liked that you gave a task to the audience, especially because we have the participants, we have the students of today's class seem to be very well educated about mental health disorders and have a lot of questions for you about them. So it's good to say there's even more of a role to play if you are someone who knows about mental health disorders. There's a lot of advocacy that remains to be done in Algeria in particular. And everywhere, even in the US, this is a big, big problem. Well, a lot of the questions we have coming in are about mental health, sort of specific mental health symptoms. What is your advice for someone who's struggling with mental health symptoms, maybe more of the daily variety of dealing with depression, or someone was mentioning dealing with burnout? What do you tell a patient who comes in and they're not at a stage of needing medication, but they are struggling on a daily level?
So it depends, of course, it depends on every specific case. But if we take, for example, depression, the first thing that you have to figure out is to seek professional advice, meaning you have to see at least a psychologist who will try to figure out if this is medical, which means it requires some chemical or medication support or not. Usually when you have depression, or when you have a burnout, it is simply your brain telling you that there is something that is beyond the capacity that you're capable to deal with. So if you go, for example, to the gym and you want to do biceps curls, for example, and you're used to lift 10 kilograms, but then suddenly you take away that's 20 kilograms and that you try to do the same amount of reps that you used to do with 10 kilograms. This is not going to function. Your muscle is going to get tired sooner. It's the same thing with depression and burnout. It's just telling you that your mind is not able to take that amount of stress that you are currently taking. You either have to take down the effort and the stress that you're receiving, or you have to augment the capacity for you to be able to deal with it. Of course, you can't increase your brain size, but you can decrease the stress amount. And this is the key here, decreasing the stress amount. How do you do that? You can do it either through emotional and social support. Here, the friend support is very important. Never stay alone, especially if you're depressed. I know this is very easy to say, but try to hang out with friends as much as possible. Second thing is, of course, I think there is some sort of a taboo and stigma about this because a lot of people have a misconception that mindfulness meditation is actually some sort of Buddhist or monk or Hinduist practice. It is in fact scientifically proven that it is only attention practice. So mindfulness in Arabic means it's the translation is ta'ammul, is plain simply an effort where you focus on your body for a certain amount of minutes and you scan your body for a certain amount of minutes. And there have been data and evidence that the amount of depression and the amount of anxiety decreases significantly, sometimes even equivalent to antidepressants after 8 weeks of mindfulness. So this is one other key thing here. Mindfulness, I think, is very, very helpful. I think we also forget to connect with nature, taking walks. Many businessmen, entrepreneurs, millionaires, geniuses, scientists take walks, daily walks, because that boosts their mood and that boosts their creativity. I think listening to music and art in general is also very helpful, and this is what we call art therapy. So I think those are some of the ideas and suggestions on how to cope with depression, burnout, stress, anxiety.
Thank you, Zach. I think that's a great metaphor. In the gym, would you get mad at yourself for not having the capacity to lift something? The same way we get mad at ourselves when we overwhelm and we can't continue to function in life the same way, right? There's a double standard in our reactions as well.
Absolutely.
Okay. What is your advice for someone who wants to work in the mental health field or become a doctor like you or become a therapist?
I think obviously the credentials are important. Those are steps that you have to go through. So you have to either go through med school if you want to become a doctor, or go through psychology studies if you want to become, for example, a psychologist. Once this is achieved, once you get your degree, then I highly recommend that you actually get more professional training, especially what we call continuous professional development or continuous medical education, where you stay up to date in the latest trends. I highly highlight that because today mental health is changing a lot. We talk a lot about nowadays, this even paradigm is changing. The term we're now talking about is brain health. That encompasses mental health, but also somatic, meaning physical brain health, such as Alzheimer's disease, such as Parkinson's disease, neurodegenerative disease, neurodevelopmental conditions such as autism, ADHD, dyslexia. Those are topics that are very uncommon and unknown in many areas in the world, including in Algeria. Today, there are a lot of emerging evidence about what we call neurodiversity and neurodivergent people, where we consider today certain forms, not all, but certain forms of autism, ADHD, for example, just as a different way the brain is wired and the different way we relate to the environment and to the world around us. So I think staying up to date with continuous professional development will keep people updated on that. And the reason I'm highlighting it is because there are many people that I've seen in my consults who had either ADHD, were autistic, had some sort of different brain wiring, and weren't necessarily having any mental issues, but they were under antidepressant or very heavy anti-anxiety medication, and they were dependent on this medication because they were just unhappy. They were the prime reason of their depression was because they were unhappy. And why were they unhappy? Because they ignored that they were just simply different. And just knowing that they were different was actually the solution and the cure to their own unhappiness. So I think it is very important today to stay up to date. So my advice to our audience is that, of course, get formal credentials, get the formal education, but then also stay up to date. And you don't need to get education to get up to date. On the other hand, I think to highlight something that is very important as well is to quickly label and diagnose people if we don't have the credentials and we don't have any actual professional expertise. It doesn't take just reading a psychology book, unfortunately, or a self-development or a self-help book to become a psychologist or to become a psychiatrist. And I've seen many, many people label certain persons as having narcissistic personality disorder, bipolar disorder, borderline personality disorders. And this is, I think, very dangerous because even experienced psychotherapists, experienced psychologists and psychiatrists take time and prudence in actually establishing a diagnosis. So I think it is very important also to not very quickly diagnose anyone, but I think we should all read about psychology literature.
Okay, thank you, Zach. So I'm going to move to some audience questions, and there's one that has come up a few times, and it's similar to what you're talking about. Sort of, don't let your friends diagnose you, don't diagnose yourself, go to a professional. But at the same time, how do we find a good therapist? And do you think, someone's saying, in Algeria, will we find good therapists? Will we find people that can support us? Do you have advice for how to find the right professionals to help you in Algeria?
Yes, I think, first of all, of course, there are the typical resources that you can use. Usually it's Google, social media. Okay. And I think the best way for you to know if a therapist is good for you or not is to judge after a couple of sessions. Two things. Okay. Do you feel that you are being heard? And do you feel that you are improving? Those are the two very important criteria. Does that resonate with you when your therapist is talking to you? The therapist or the psychiatrist doesn't have the right to label you or to stigmatize you or to shame you or to judge you. That office where you go and talk is supposed to be a safe, non-judgmental space. This is critical. If you don't feel okay, you can walk away and seek somebody else. I think this is the two main criteria I usually advise people or patients when they want to seek therapy.
And they were, do I feel heard? Was this the first one? Just to reiterate the two.
Yes, the first one was, do I feel heard? And the second one is, do I see progress?
Do I see progress? Yes. Okay, this is great. This is great.
When I say, do I feel heard, is also, I would also slash, does that resonate with me? Does that make sense? Is this therapy helping me also make sense of what's going on? Because usually our behaviors and whatever symptoms we have are actually just a manifestation of something underlying. And when this therapist helps you go through the steps to understand, that's already 50% of the treatment.
Yeah. Okay. All right. Very good advice. We have a few people asking about supporting friends or maybe family members. I'm not sure. They're quite different, but maybe the answer is similar. One is asking, how do you help someone who's suicidal, who you know is suicidal? Someone said, how do you help someone dealing with a childhood trauma? Essentially, what should we do if we are a bystander or a witness to someone who's experiencing some severe mental health symptoms?
So I think the first thing when you talk about suicidal, I think effectively you have to be there physically to try to intervene if there is immediate harm. This is the first thing that you have to do. The second thing is, again, goes back to my initial advice, which is seek psychological support and psychological help from a professional. Because if somebody is suicidal, there is something wrong underlying. There is a distress. This is an acute distress, meaning that this person cannot bear the burden of whatever suffering. They are calling for help. They are calling for attention, especially if somebody is talking to people around them and actually saying it. If they say it, it means that they are trying to get attention. They're trying to get help. This is their way to say, help me. So I think it is very important to orient them towards psychotherapy or towards a mental health professional. This is the first thing. You also have to support them in a way where you take out that stigma. And today, I think thanks to COVID in a certain way and post-COVID, people have realized the importance of mental health and the importance of seeking psychological help without necessarily thinking that they are going insane or thinking that they are going crazy. And I think this still exists, unfortunately, in Algeria. So I think it is important when you are being a supportive friend, when you are being someone who is supportive to your friend, is to tell them that this is okay. This is absolutely fine to go and seek support. You're not crazy. This is the first thing. I think second thing is when you're trying to talk about people who have some other type of disorders, especially you've mentioned earlier in the session, invisible disabilities. And I think this is very important because there are a big proportion of suffering and distress is actually invisible. And sometimes it is emotional, and sometimes there is actual somatic pain. To face that, I think, especially for invisible disability, we should be careful about also when you're supporting someone who has a certain condition, not to make them feel that they are ashamed or make them feel that they are less of human being. This is very important. You have to be very careful with the words that you use. You have to give them assertiveness. You have to let them be assertive, and you have to acknowledge them as they are and not talk about somebody as if that disability or that condition is miskeen. I think this is very, 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 very dangerous. This is what we call ableism, meaning that you are treating somebody as less of a human being because of the condition that they have. And it is very important if you're being, sometimes it's not intentional. I'm not saying that it is, you're doing this intentionally, but you have to be careful about the way you are also being supportive. I think those are two critical points in the comment, in the question that you've asked.
Okay, thank you so much. I have one more here, which comes back to your comments on addiction. As you see a trend of addiction in Algeria, someone is asking, how can you help a patient if you're a doctor and you're seeing a patient who's struggling with drug addiction?
My experience in the field in drug addiction in Algeria has taught me and showed me that 99.9% of people who start using drugs start them because of their immediate social circle. That's the first thing. I have not seen a patient whom I asked, how did you get started on X or Y heavy substance? And answered, oh, I was just home alone and I was bored and I just thought I would start. It doesn't start like this. It starts through the social circle, social environment, bad friends, and throughout different sessions. It doesn't take once. It takes sometimes many months, sometimes many years. And there's one day you're on a bad mood, you've had a bad day, you're having some problems, and you decide to try. So I think the first thing is to try to help this person to get out from that bad influence that is around them. And usually it's one person, usually it's an environment, usually it's an environment. This is the first thing. Second thing is usually everyone wants to stop. Everyone wants to stop. And the motivation usually is because of their parents, because of something that has happened in their life, and it was just a wake-up call for them. And I've seen so many people in the rehab and the detox centers where there was very, 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 very difficult prognosis for them, or bad prognosis for them, to quit. And they were able to quit because of simple faith and belief that they had. Usually it's parents or religion. Those are the two main reasons people stay strong and don't give up. So if you want to help a friend, first of all, make sure that you take them out of that social circle. And when I say social circle, by the way, drugs in Algeria affect every single person despite their social status. It's not only the super rich, it's not the super poor, it's everyone. And I say everyone from different ages, including underage. So when you see a drastic change in behavior, when you see a drastic change in mood, when you see irrational behavior that is not usual to that person, first thing to do is to exclude them from that social circular environment and take them to the professional advice. There are places in Algeria that do rehab, as opposed to what we believe in the general. There are doctors who are trained, psychiatrists, who are trained in actually helping people getting off heavy substance conditions, including cocaine, heroin. Today, unfortunately, in Algeria, the problem is that people are not only using those substances, they mix them with other drugs, chemical drugs like medications, and this complicates their situation and the detox. But it is doable if there is social support, friends, excluding them from the environment, having the professional psychiatrist be there, and having the psychologist who is in between the sessions also there. So it is possible.
Thank you so much, Zach. This has been so insightful. I know for me, as someone who's a foreigner living in Algeria, learning about the opportunities for treatment, but also for the guests here, because I think it is hard to get this information and it is so important. I have one last question for you before we have to close. And it's a question someone asked right when you started talking, and I loved it. It was, what are some of your top book recommendations? When you said everyone should be reading books about psychology, do you have one or maybe two that you like to recommend to people who are interested in these subjects? And if it doesn't come to top of mind, I can share, afterwards via email with the participants. But
yes,
I'd love to know, Dr. Zaki Allal, what are your recs? Mm-hmm.
I would definitely think about a couple of books and get back to you and to our audience with the list. And you can email them as well. This way they can take the time to look for them. Amazing.
Well, I'll invite the participants to join me in saying thank you. Thank you for coming. This was so incredibly insightful. It's recorded. It's going on YouTube. I imagine this will be one of our most watched sessions for the expertise that you brought to the conversation. So thank you again, Dr. Zaki Allal.
Thank you, Ariella. Thank you for the invitation. It is a pleasure. And I look forward for the next sessions that you have, and good luck.
Thank you.
Thank you.
And thank you so much for everyone to join today. We will be closing on that note. Have a good night, everybody.